the size is less than 1 centimeter, a size of a finger. And usually there are 2 to 10 nodes in each location. And in the whole body, you usually have around 600 lymph nodes. And in the lymph nodes, the lymphocytes are glowing. And when people get inflammation or infection, then lymphocytes are traveling around from the lymph node. And important to remember that inguinal lymph nodes can be palpated without any diseases. So it's important to know. So, sometimes you can actually feel the inguinal lymph nodes in the normal patients. Okay, then let's move on to the differential diagnosis for the lymphadenopathy. So I prepared a case. So, so this is a case, 25-year-old lady with chief complaint of fever and cervical lymph node swelling. So her fever lasted for 5 days and her temperature was 39 degrees Celsius. And she noticed a lymph swelling in the left side of her neck. So that she decided to visit the emergency room. So what is most likely diagnosis? I know that it's very difficult to confirm the diagnosis with this limited information, but I'm gonna do the quick questionnaire here. So let's try it. So what is the most likely diagnosis for her? Number 1, COVID. Number 2, infectious mono or bacterial infection, tuberculosis, Kikuchi disease, or malignancy. So I'm gonna give you a few minutes to answer. I know it's hard to determine the cause, but let's take a guess. Okay, so we can see the results. So now it seems like the most popular answer was bacterial infection, followed by infectious mono and Kikuchi disease. All right, thank you so much. All right. So actually, all of them are a good differential. Let's see. So differential diagnosis for the localized lymph node swelling. In order to think about the differential diagnosis, it's important to understand the local lymph drainage. And also important to know that systemic diseases can present with localized lymph swelling. So let's say, usually when you think about the lymphoma, it's obviously the systemic disease, but lymphoma actually can start with, let's say, cervical lymph swelling. So in terms of cervical lymph node lymphadenopathy, so as many of you answered, head and neck infection is one of those. And also viral infection, including EB virus, cytomegalovirus, or HIV, can be the cause of cervical lymph node lymphadenopathy. And also cancer, head and neck cancer, can be the cause. And if you find any posterior lymph nodes in the neck, then the likely cause of the cervical lymph node is either virus, tuberculosis, Kikuchi's, but not bacterial disease. So usually a bacterial disease is not really causing the posterior lymph node swelling. That's essential to remember. And also tuberculosis is usually limited to cervical lymph nodes. So if you think about the differential diagnosis for inguinal lymph nodes or axillary lymph nodes, then TB is less likely. So in this case, because we saw, patient have cervical lymph nodes, then TB is one of the differentials. And also supraclavicular lymph node. If you find any supraclavicular lymph nodes, important to remember that 50% of the cases are malignancy, especially the cases like above 40 years old, then you need to be concerned about malignancy. And if you find right-sided supraclavicular lymph nodes, then you need to think about either a mediastinal lung cancer or esophagus cancer. And if you find left-sided supraclavicular lymph nodes, then the cause can be the intra-abdominal source. And it's actually called Burkitt's lymph node. In terms of the differential diagnosis of systemic lymphadenopathy, the differential should include infection, malignancy, drug. Drug is the important one. Autoimmune disease, including SLE, endocrine disease, including Hashimoto's, or some other causes. In terms of infection, once again, viral cause include EB virus, cytomegalovirus, or HIV. Bacteria, sometimes you see Yersinia infection. It's actually causing GI infection, but also people can have lymph node swelling. And once again, TB is a big one, and parasites, toxoplasma can cause systemic lymphadenopathy, and syphilis, Lyme disease can be the cause. In terms of malignancy, if you work in the university hospitals or referral hospitals, actually the 60% of the cases are reported to be malignancy. On the other hand, if you work in the primary care setting, then it's going down to 20%. So actually you see more bacterial infection or viral infection than the malignancy. And when you think about malignancy, solid tumor can be the cause, but also the lymphoma, leukemia, also can be the cause of systemic lymphadenopathy. Drug is a big one. Antibiotics can cause lymphadenopathy, and also anti-epileptic drugs and alpurinol might be the common cause of lymph node swelling. Other causes include Kikuchi's disease, Castleman disease, Still disease, and sarcoidosis. So these are the kind of differential diagnoses for the lymph node swelling. Then let's think about the history taking. So back to our case. So she had a fever of 39 of 5 days duration. She has a lymph swelling in the left side of her neck, and she visited the emergency room. So what would you ask? So in the history taking, first, it's important to ask how long the lymph swelling lasted. So the duration, is it days, months, or years? Also ask about local symptoms, including pain, warmth, or redness. I don't know if you are familiar with B symptoms, but if you think about the lymphoma, it's important to ask B symptoms, and B symptoms include fever, weight loss, and night sweats. Past medical history, atopic dermatitis, tuberculosis are can be the cause of the lymphadenopathy. So it's important to ask. And medications, as we reviewed, allopurinol, antibiotics, and antiepileptic drugs can be the cause of the lymph swelling. So it's important to review the medications as always. And smoking, of course, because smoking can be the risk factor for the head and neck cancer. And travel history, pets, sexual history, because those are the risk factors for infection. So let's go back to our case. So we asked the duration of the symptoms, and she answered she had it for 5 days. And she has a local symptoms, including pain and warmth. In terms of the B symptoms, she had a fever, but she denied any weight loss or night sweats. She had no past medical history. She's not taking on any medication, and she does not smoke, and she has never smoked. She had no travel history, no pets, no sexual intercourse. So with these information, what is your likely diagnosis? So let's take that questionnaire again. So is this COVID? Is this infectious mono? Is this bacterial infection? What do you think? Okay, so we can see the answer. So now I think the most popular one is infectious mono. Okay. All right, and then, yeah, interesting to see that only one participant answered with COVID, even though COVID is so prevalent. Okay, great. So these are important to ask, and even though most of us answered with infectious mono, it's still hard to determine whether it's infectious mono or not. But I guess because the infectious mono is so common, especially for this young population, I think that's why many of us thought this might be infectious mono. And also, it's reassuring that she doesn't have any B symptoms except for the fever. And also, she has no other significant past medical history. So it's hard to imagine she has head and neck cancer or some serious conditions here. Okay, so let's move on to the physical exam. So what exam would you perform when you see the lymph node swelling? So in the physical exam, first, you're gonna see the lymph node itself, but what do you assess on the lymph node? So first, you're gonna assess the firmness, and then size of the lymph node, mobility, tenderness, border, and location. Those are the things you're gonna assess on the lymph node. So in terms of the firmness, if you feel like the lymph node is like a lock, then, then it's actually likely solid tumor. So if you feel the lymph node and it's like a lock, then you need to think about the solid tumor. On the other hand, if it's like a lava ball, I don't know, lava ball is popular in Cambodia. It's very popular in Japan. But if you feel like it's a lava ball, and it's likely lymphoma. And if it's like gummy, more soft, then it's likely inflammation. So even with the palpation, you can kind of differentiate the diagnosis. In terms of the size, if it's very, very small, then the likelihood of malignancy is very small. But if it's really big, like bigger than 2 centimeters in diameter, and we start, being concerned about the malignancy. And actually, one of the studies showed, if you see the lymph node bigger than 1.5 centimeter, the prevalence of malignancy is around 38%. But it really depends on the clinical setting, though. So if you find the lymph node less than 1 centimeter, let's observe. But if you find bigger than that, bigger than 2 centimeter, then you need to take action. So size is an important factor. And then in terms of the morbidity, so usually the normal lymph nodes are very, very mobile. On the other hand, if you find the immobile node, then it's always abnormal. So what we are concerned about when we find the immobile lymph nodes, the cancer, because the cancer can invade the surrounding tumor and that can be fixed in that location. So that can be immobile. But on the other hand, actually the post-inflammatory state, the inflammation can cause the fibrotic changes, and that fibrotic change can cause immobility. So, even if you find the immobile lymph nodes, you can't really say, oh, this is immobile, so we should suspect cancer. So you can't really tell the patient, oh, this should be cancer, because this can be actually post-inflammatory state. Also, the important factor to check is tenderness. If patient has tenderness on the lymph node, that means the patient has inflammation in the lymph node. But tenderness is not equal to infection, it's inflammation. So, let's say lymphoma can cause inflammation, so it's not limited to infection. That's important to remember. And also, if the patient has pain, the subjective pain, then it can be a sign of rapid growth. So it can be infection or it can be rapidly growing malignancy, including lymphoma. In terms of the border, if the border of the lymph node is regular, then the likely diagnoses are either inflammation or lymphoma. But if it's irregular, like a lock, then you need to suspect solid tumor. Also, location is important if it's localized or if it's systemic, because as I show in the previous slides, if you see the systemic lymph nodes adenopathy, then you need to think about the systemic disease. But if it's localized, then it's more localized, let's say, infection. If it's more like localized infection or something else. Okay, then so when you check the neck, when you assess the neck, and you do, I know you're gonna do the physical exam on the neck, then you need to thoroughly assess all the lymph node location. To assess the cervical lymph nodes, I usually start with inframaxillary lymph nodes around here. And then I usually start around here, then going to around here. I don't know if you can see my arrow. And then going up to pre-auricular lymph nodes. And then you can go back to the post-auricular lymph nodes. And then you need to also check the posterior cervical lymph nodes, and then anterior cervical lymph nodes, and then supraclavicular. So there are 7 major locations to be assessed. So inframaxillary, submental, pre-auricular, post-auricular, posterior cervical, anterior cervical, and supraclavicular. And I think you need to have your own system, but I always start with around here, then going here, and then going around the ear, then going to posterior, anterior, and then supraclavicular. That's my system. But I think you need to have your own system to thoroughly assess the lymph nodes. And also, even if you see the patients with cervical lymph nodes, it's important to assess the axial lymph nodes as well as inguinal lymph nodes too, because sometimes people are missing those lymph nodes, and you can find the inguinal lymph nodes or axial lymph nodes, then your differential diagnosis can be changed. After you finish the palpation of the lymph nodes, it's also important to check inside the mouth because there are multiple lymph tissues in the mouth as well. So don't forget about the mouth oral examination. And also abdomen, because sometimes in case of lymphoma or leukemia, sometimes people have hepatomegaly or splenomegaly. So it's important to do a palpation on the liver and spleen. And also sometimes you can find a huge mass in the abdomen. So it's important to do the abdominal exam. So in this case, I did the physical exam and I found 1 to 3 centimeter left cervical lymph nodes. And it was located in the anterior and posterior cervical. There was a tenderness, and also the lymph nodes are all movable, and it was elastic hard with regular border. But I didn't find any inguinal lymph nodes or axillary lymph nodes, and there was no tonsillar swelling and no hepatosplenomegaly. So based on these exam findings, what's your likely diagnosis here? So let's do the questionnaire again. So the same differential diagnosis list. Okay, so still infectious mono. I'd like to kind of know what's the reason behind. Could you answer, Ko-sensei? What was your answer and why did you think that way?
Well, this patient is a young female with multiple lymph nodes, lymphadenopathy, and I just thought, considering the prevalence of the disease, I think that is most likely.
Right. Yeah. So right. So in this case, because the lymph nodes are up to 3 centimeters, so not that big. If it's like 6 centimeters, and then the story is totally different. If you find the 6 centimeter lymph nodes, then I think you're gonna jump on the either lymphoma or solid tumor. But in this case, we only found 1 to 3 centimeters, so it's reassuring for us, especially for this young lady. We can still think, oh, most likely diagnosis is infectious mono. And also, if you look at the local findings, actually this patient has tenderness. So, okay, some inflammation is going on. So it's not like a solid tumor, maybe it's infection. Then it's also movable. That's reassuring. Movable, it's not immobile. If it's immobile, it's more concerning, right? And also it's not like a rock, and it's not like a super hard, it's elastic hard. That's also reassuring. And then regular border, if it's irregular, then we need to be concerned about the malignancy. So in this case, these are kind of reassuring local findings, and those are kind of consistent with benign disease, including infectious mono. And as co-sensor mentioned, it's very prevalent in this population. So infectious mono might be the most likely diagnosis. I kind of agree with you. So here's my differential diagnosis in this case. So the most likely diagnosis was actually infectious mono, but also I included Kikuchi disease and also tuberculosis, because tuberculosis is also kind of prevalent in Japan. I don't know in Cambodia, but in Japan, the tuberculosis is prevalent. And also malignant lymphoma, it's less likely because, you know, the duration is 5 days, and also she clearly has benign signs in the local area. So I suspected more infectious mono or Kikuchi disease, both are benign disease. So I was thinking about the benign disease rather than the malignant lymphoma. So I thought it's less likely. So what's the next step? So now we have a good differential diagnosis and we suspect infectious mono. So what are we gonna do? So I'm gonna talk about the test. So, you know, sometimes when I work in the university hospitals, we just send all the tests like CBC, BMP, LFTs, like lots of like tumor markers, like et cetera. But, you know, it's important to remember that you need to order tests based on your differential diagnosis. You can't really just throw everything. And it's important to know that there's no single test to lead a single diagnosis. So, you know, history taking and also physical exam are two major components to confirm the diagnosis. But in case if you find any systemic lymph node swelling, then you need to suspect lymphoma or like other malignancy. Then you can order CBC, LDH, and IL-2 receptor, and CAT scan with contrast to kind of see, you know, especially in the intra-abdominal source or like mediastinal lymph nodes, we can't really, you know, palpate. So CAT scan is helpful. And sometimes we need HAB or HTLV1 in the case of systemic lymph node swelling. So those are kind of helpful lab tests. Imaging study, sometimes I see that the physicians order ultrasound of the lymph nodes, but ultrasound is not that helpful. It's useful to differentiate from cysts, but with your good palpation and good observation, I think you know, we can often differentiate from cysts. So if you are kind of confident, oh, it's not cyst, it should be lymph node, then you don't need to order the ultrasound. It's not really helpful. But the CAT scan can be sometimes useful, especially for the case when you are looking for mediastinal lymph nodes or intra-abdominal lymph nodes, then CAT scan is something like, you know, go-to test. Or you need a staging of malignancy, then the CAT scan is very helpful. Also, I like to kind of mention that the importance of monitoring. So if you feel like it's very difficult to make a diagnosis on the initial presentation of the lymph swelling, just based on the history, physical, and also the basic labs, you can't really make a diagnosis. Then it's important to watch and wait, not like jump on the you know, the biopsy or like some other invasive tests. If it's small, then it's important to just watch and wait and follow up in 3 to 4 weeks and reassess. If it's really big, if it's, let's say, if it's 6 centimeter, then go ahead with that, with the biopsy. But if it's like, let's say 2 centimeter or 1.5 centimeter, and there's no other lymph node, then just watch and wait. and then follow up in 3 to 4 weeks and reassess. So that's a good strategy for the lymph node so that we can avoid unnecessary invasive tests. And antibiotic use. So actually in like our case, like in adult cases with lymph node swelling, even though I would say like 50% of us answered with bacterial infection as a most likely diagnosis for that case, actually the bacterial infection in the adult case is very, very, very small. The chances are very small. So usually if you find the lymph node adenopathy, it's usually either viral infection or if it's big, if it's like bigger than like 5 centimeters, then you need to suspect malignancy. So it's not recommended. The antibiotics use is not recommended for the lymph node adenopathy. Of course, if the patient has like very high fever and throat pain, and you find tonsillar swelling, and you kind of think about the bacterial tonsillitis, then go ahead and prescribe antibiotics. But if you just find the lymphadenopathy, then it's not recommended because the bacterial lymphadenitis is very rare in the adult cases. So it's not recommended. And the when to do a biopsy, if you find any systemic symptoms, including B symptoms, fever, weight loss, night sweats, suggesting lymphoma, then you need to do a biopsy. And also if the patient has a heavy smoking history and they have weight loss, then I think you suspect malignancy, then you need a biopsy. If you decide to do a watch and wait, and there's no improvement in 1 month, then I think you need to proceed with biopsy. Or if it's getting bigger, then you need to do a biopsy. And open biopsy is a preferred mode of biopsy. And open biopsy is a go-to test. And needle biopsy is less useful. Of course, it's case by case, especially for like our case, she is a 25-year-old lady, and I can understand that she doesn't want any like big wound on her neck. So in her case, it's a tough choice. If you really think about the lymphoma, then I think we need to offer the open biopsy. But if you think it's less likely, then maybe needle biopsy is go-to. Oh, I'm sorry, it's written in Japanese, I'm sorry. And then once you got the biopsy, then you're gonna send it to the bacterial culture, AFB culture, and also the test for the lymphoma. And when the needle biopsy is useful, usually it's useful only for the recurrent cancer. Why don't we use needle biopsy? Because there is a high false negative rate. So, if you can do the open biopsy, the false negative rate is much lower because we can really see the tissue structure with the needle biopsy. But with the open biopsy, you can see the whole tissue structure. And especially when you think about the lymphoma, the tissue diagnosis is essential. So, you need to have a big tissue to get the diagnosis. That's why the open biopsy is more useful than the needle biopsy. And actually, there is a study showing that fine needle biopsy can confirm the diagnosis of the lymphadenopathy only in 27%. So let's go back to our case. So actually, I decided to observe her for 2 weeks with NSAIDs, but she didn't have any improvement. And actually, lymph nodes increased in size. It was actually initially 1 to 3 centimeter, but it was bigger, around 4 centimeter in diameter. So I was more concerned about her, and I thought, oh, it's been 2 weeks and it's getting bigger. Still could be benign disease, but it's, it's 2 weeks. So I mean, it could be still benign disease, but, lymphoma can be also the cause, because from the onset, it's been already like 3 weeks. So, oh, maybe this is lymphoma. So we kind of discussed thoroughly with her and also with her mother, and actually open biopsy was performed. And in the open biopsy results, we saw the necrotic tissue, but there was no malignant cells. Yeah, we were so relieved. There was no malignant cells. So we diagnosed her with Kikuchi disease. If it's infectious mono, it's been 3 weeks, so it should be already better. But since it was a longer course, I suspected Kikuchi disease as well. But because we saw the necrotic tissue in the lymph node, we diagnosed her with Kikuchi disease. So we started steroids, and she actually resolved with steroid taper. And actually, she had a recurrent disease. Actually, I used hydrochloroquine as a malaria drug, and she resolved with hydrochloroquine with steroid. Okay, so this is the last slide. Takeaways. So in terms of the palpation of the lymph nodes, inflammation is gummy, lymphoma lovable, and solid tumor rock. If you find the lymph nodes bigger than 2 centimeters, consider biopsy, but open biopsy is a preferred mode of biopsy to rule out malignancy. Exam is not limited to lymph node palpation. You also need to do a mouth oral examination as well as abdominal examination. And imaging studies, especially the ultrasounds, are not usually contributing to the diagnosis. So history taking and the exams are more important than imaging studies. And in the adult cases, it's not for the pediatric cases, but if you see the adult cases, almost never use antibiotics because it's very, very unlikely to be the bacterial infection in the setting of the lymphadenopathy. And once again, if you need to do a biopsy, open biopsy is a preferred mode. Okay, thank you so much. So I'm open to any questions.
Thank you, Dr. Yamada, for a great presentation and sharing really important tips to see a patient with lymphadenopathy. So we've got several questions in Q&A session. One of the question is, do you measure the size of the lymph node by ultrasound, or is there any other way to do it quickly?
Okay, so if you are the person saying that ultrasound is one of my physical exam, then just go ahead. But you don't need an ultrasound to measure the size. You can just use a finger. You can palpate the lymph node, and you can measure with fingers, because if the size is like, let's say like 2 fingers, then it could be like 2 centimeters. And if you feel like it's okay, it's four fingers, then it could be 4 centimeters. It can be a little inaccurate. It can be very rough, and you can use your fingers to measure the size.
Okay, thank you so much. We have another question that the expert MTB, or I'm not sure how to read this, RLF, is necessary to test when there is lymph node swelling. I guess it's a test for TB.
For the TB.
Not sure.
I see. If your hospital can do the standard tests, including bacterial cultures, AFP cultures, and also, you know, the pathology, then I don't think you need a TB specialist, or I don't know what else, that like any specialist. But if you have a standard kind of like, you know, test, and also the pathologist, you need a pathologist to see the biopsy results, but I don't think you need a TB specialist for that.
Or I guess it's a special device to detect a certain kind of tuberculosis. I'm not sure. Actually, we do not. I've never heard of that. But thank you so much
Dr.
for this.
Harada.
Okay.
Yeah, maybe this means the gene expert. So it's a PCR, especially for TB. So
see.
maybe in Cambodia,
Okay.
TB is very, very common. So
Okay.
some hospital routinely do gene expert, but I'm not sure it's suitable for lymph nodes.
I see.
Usually
So,
we do sputum. Yeah.
yeah, and also it's usually obvious on the gross finding. So if you really suspect the TB, but the test is negative, then you can use the genetic testing. But we don't usually need a genetic testing to confirm the diagnosis.
Right. Thank you. Another question in chat box is for axillary lymph node and glowing lymph node, which one is most likely sign of malignancy? Which one is likely malignant?
I see. So I think it's always case by case, but again, as I mentioned, you know, inguinal lymph node can be normal. Even if you find like 2 centimeter inguinal lymph node, it can be actually normal. So in terms of that, I would say maybe axillary lymph swelling is more likely to be a malignancy compared to the inguinal lymph nodes. Because, you know, I think that if you find the axillary lymph node swelling, then you will be concerned about breast cancer or lymphoma. But it's also important to know, because now we are kind of like expanding and giving all the people the COVID vaccine, and COVID vaccine can cause axillary lymph node swelling. It's important to remember, if people complain of lymph node swelling in the axillary area, like in like 5 days after the COVID vaccine, and I think it's due to COVID vaccine. And in the Moderna study, actually 10% of the people experience the lymph node swelling. So it's important to know that it's a very common adverse event after the COVID vaccine too.
All right, thank you so much for the answer. We have another question. Why test not includes CMV and EVV? It's about the tests to perform. I guess you mentioned about the test for cytomegalovirus or EV virus.
Again, it's really it depends on your differential. So you think about infectious mono, then you need to send the EV virus or cytomegalovirus. It depends. You won't really send EV virus or cytomegalovirus for all the cases. It depends on your differential diagnosis.
Right. Another question. For this case, like the dosage and duration of steroid use, what is the dosage and duration of steroid use for this Kikuchi disease?
So there's no standardized treatment strategy for Kikuchi disease. I use that 0.5 milligram per kg per day of the prednisone for that case, but there's no like textbook answer. So kind of you need to kind of like try, and then you will see how the patient respond. And if she responds, then we can taper. So there's no like such, you know, the standardized strategy. So it's really depending on the case.
Okay, we've got plenty of questions. Okay, so I'm gonna pick up this one. If lymph node size was no change after observation around 1 month, how long can we keep observation or we need biopsy?
Yeah, so usually you can make a follow-up appointment in 3 to 4 weeks, but also it's important to tell the patient that if the lymph node is really getting bigger very rapidly, then they need to come back sooner. Otherwise, they can stay at home and they can come back in 3 weeks or 4 weeks if it's no change. Because even if it's, if it's lymphoma, sometimes we need a month to kind of differentiate. And if it's a benign disease, in 3 weeks or 4 weeks, it's going to be disappearing. But if it's lymphoma, it's going to be staying there. But it's also important to say that come back sooner if the lymph node is getting bigger rapidly.
Okay, thank you. So now I'd like to hear some comments or questions from the panelists. So Ayad, could you speak?
Hi, Dr. Yamada. That was great presentation and that was really informative and I enjoyed. I actually have a question. So I'm a pharmacist and let's say I'm working at the community pharmacy and patient comes to the clinic and say, oh, I have a little bit of, swollen neck. And patient said like, I don't have any fever, just a little bit feeling chilly, but that's all. Do I always have to recommend patient to go to see a doctor, or do I say just NSAID, take an NSAID, feeling better, that's okay? What is some sign and symptoms that we have to recommend patient to go to the doctor?
Yeah. So first, maybe the size. If it's let's say if it's bigger than 2 centimeters, definitely you need to send the patient to the hospital. If it's like 1 centimeter, actually dental caries can cause the small lymph nodes. So it's very common for people to experience very small lymph nodes in the neck. And if that's the case, so the people can closely follow up by themselves. And then if it's getting bigger, then they should go to the hospital. If it's gonna be disappearing, then that's fine.
Okay,
So,
then most likely that size and also if maybe
the course.
A course and okay, thank you.
All right, thank you. Do you have any comments from Dr. Hayashi?
Oh yeah, thank you so much, Dr. Yamada. It's very interesting stories and lectures. One question, you mentioned that the immovable lymph node is always abnormal. What do you mean by that? Do we have to do biopsy every time, or have to be very carefully follow up, or anything else?
So the normal lymph nodes should be mobile and should be movable. So if it's immobile, then something is going on. But it can be cancer, but it can be also inflammation. So it's important to remember it's not equal to cancer. Sometimes I get referral from primary care. Oh, it's immobile lymph node. It should be cancer, but it's not equal to cancer. So it can be actually inflammation. So it's really, it depends on the clinical course and also the case presentation. Like her case is 25 with no history of smoking, no history of cancer. In such case, we shouldn't jump on the head and neck cancer. So we think about, oh, maybe this is a chronic inflammation. Something is going on like viral infection or bacterial infection. And if it's getting bigger and bigger, then we think about the biopsy. So it depends.
Okay, thank you so much.
Thank you. So now we have the last one question to cover. It's about tuberculosis. Does the TB swelling lymph node will disappear or reduce size when it's done of the treatment?
I'm sorry.
When treatment is done, the swelling of lymph nodes due to tuberculosis can disappear or reduce? That is a question.
Yeah, should be reduced, but it can stay there. And actually, you can see the fibrotic tissue even if the treatment is successful. So you can see the 1 centimeter or 1.5 centimeter lymph node, but it can be, the size can be reduced. So the size can be should be decreased.
But I think Dr. Hayashi has experience about that. What do you think about that? You do not have.
Sorry, I don't have the experience.
Thank you so much. So now we're going to close this seminar today. Thank you, Dr. Yamada, for your great presentation. Lastly, I have a few announcements to make. The next seminar is planned on April 24th. It's Saturday, and the lecture title is A Practical Approach to Numbness. And the lecture will be made by Dr. Hayashi. I'll send the webinar link to all of you, and so that you do not have to sign up for another Google form. And also, I'll send you the PowerPoint slides we used today to your email address after this lecture, maybe tomorrow or the day after tomorrow. So again, thank you so much for your time, and thank you, Dr. Yamada, for a great lecture, and thank you all of you for a great discussion. And I hope you have a great weekend, and I hope to see you next time. Thank you so much.
Thank
Thank you,
you.
Aya.